Hello everyone, this is Dr. Ryan House. Lately, I have seen so many cases of runners and runners type of injuries. Today, it seemed inevitable for us to talk about those. I guess it's running season right now here in our community. We have had Sherry's Run, we got Murfreesboro Half coming up. We've had some obstacle races, Tough Mudders, Warrior Dashes. Dr. Moore even participated in a great obstacle race recently. So we have seen a lot of runners and their injuries lately. Today, we're gonna talk about a great test. You can do it on your own. If you pass the test, great. If you fail the test, especially if you're feeling some of this discomfort I'm gonna describe, then we're gonna show you a couple rehab exercises for it. This video is for you, whether you're a runner or not, if you're a walker, if you're I feel pain when I walk, okay? If you have pain from the outside of your hip to the outside of your knee, any of that line, and then skip some areas, inside of your knee to inside of your foot and ankle. So from here down and from here down. If that sounds like you, stick around. We are gonna show you now a box step down test. It's gonna be me, which funny enough, I actually failed this test on one leg and I passed this test on another. But with me, if I'm gonna do any running, it's gonna be sprinting. And with sprinters, they land on their front of their foot. So it doesn't really affect me as much, doesn't cause me much damage. But if you're a jogger, somebody who's doing the distance type of running, this video is especially for you. Stick around.
All right, so Dr. House is a perfect example of this. He's got a passing test on his left leg, and his right leg does not look so great. In order to test this on yourself, you're going to need a belt. You're going to need something to step off of, and you're going to need a mirror to either watch yourself or a friend who knows what they're looking for and can watch you. So we're going to look at Dr. House's good leg, his passing step-down test. Go ahead and do it with your left leg, Dr. House. There you go. So what we're watching, what you're looking for is for that belt to stay relatively level. It doesn't look like it would spill anything out the top of it. And for the knee that he's bending to stay relatively in line. His knee tracks a little bit inward, but not very much, so that's a passing test. Now let's look at the other side. Show him the right side there. Okay, so when he goes down on this side, you can notice that belt starts to tip downwards on his left side, and you can watch his right knee start to track inward. And if you can see it from this angle, his right foot even starts to tilt inward. All right, perfect.
So now that I've borne my dysfunctions on Facebook here, if you have this problem, if you see that you're failing this test, you can actually help yourself if the problem is coming from a weakness in your hip. Okay, there's really two reasons for this to happen. One is a stiffness in your ankle that drives you to cheat, or a weakness in your hip that allows that dysfunctional pattern. So if your problem is coming from your hip, if it's not coming from your hip and you just want to attempt to get this better on your own, which I would advise, start with one of two or both of these exercises. Number one is called clams. They are to rehabilitate your gluteus medius muscle. If you will lay on your side, on the floor is best, with a slight bend at your hips and knees, and a perfect line from your heel to your hip to your shoulders. So that way it's perfectly in line. Now, roll forward like you're trying to look at the floor with the top of your pelvis. So slight look at the floor. Then, I want you to open your knees. So the hip and the ankle is a hinge. You're gonna open the door. When you're doing that, do not roll backwards. If you do, you're doing what you do all the time, which is cheating. If you keep staring at the floor with your pelvis, then you end up really isolating this gluteus medius, which is part of the weakness that drives that dysfunction. That's clams. Do about 10 reps of those twice a day. Really fire that thing up to get it working again. Number two, a side bridge. If you will bend the knees, you're going to end up knees, elbow, lifted hips. This is an endurance type of exercise, so you want to hold this for a number of seconds. You'll want to make sure there is a straight line between your center of your knees, your belt buckle, and your chest. So you look just like you're doing a plank, okay, side bridge. All right, hold that for a certain number of seconds. You should feel kind of a contraction going on in that side of the hip where you're weak. Those are 2 exercises to help that. If it's coming from your foot, you are probably going to need us. Just be honest with you. There are some ligaments that are tight. There's some parts of the tendons that wrap around your foot and ankle that are stuck, let's say. Joint that may be locked up. So all those are reasons that you can't really help yourself. But one thing that might help, if you will take and cross this leg over that one, if this is your problem side, you will take and do a hand heel on the top of your foot, pronate or push your arch into falling, hold your heel, twist the ankle, okay? That is the opposite of what you always do. And then you'll go foot down, foot up, foot down, foot up, foot down, foot up as you go. This is called baby feet. Those weren't the greatest descriptions of those exercises, but we have those on our website, cumberlandspine.com. Go to the rehab videos section. It'll show you all about it. If this is your problem, okay, if you're a runner, if you get in pain when you walk and you're not a runner, but in those areas, try these exercises first, or just come see us. We can really help you. We've helped tons of runners lately with these kind of pains. If you like this video, click the thumb. If you know somebody, if it's you, if you think it's interesting, share it with the world. If you got a question or comment, post it below. This has been Dr. Ryan House with Cumberland Chiropractic and Sports Medicine, where we will get you better faster.